You had a root canal and it failed. Now what? I know that's very annoying thing to have. You're having pain, you went through the root canal, you did a lot of 1 hour, 2 hours appointment, and then out of sudden,
they said the throbbing would stop.
There are 3 questions that I always ask myself before I decide if I'm gonna go retrieve that tooth or I'm just gonna take it out. Number 1, what value am I adding by doing a retreatment for this root canal? For example, if I have a tooth that have voids, have gaps, short root canal, that I can fix, then I will do a retreatment. How is the restorability of the tooth? Like this tooth, can I build a crown in the end? Can I do a bridge? Can I use it as something in the future? Or is it a lost cause? Let's see a couple of cases here and I will tell you if I did it or no, why I didn't do it. Case number 1 here. This is number 30. As you can see, you have 3, 2 of them are reaching to the apex here. One of them is short. We can fix it. The second thing is restorability. It is restorable. It has good structure. I can even go 1 or 2 millimeter here without violating the biologic width. That's fine. I can also see a void here. That's fine. A void here. We can fix that. However, the biggest problem is you see how much infection here? You see this is here. This area is called furcation involvement. Furcation involvement is when the infection comes between the 2 roots. These are the 2 roots. This is the infection coming in between. In this case, furcation involvement is very difficult to clean and it has a very unpredictable future. Case number 2, I'm presenting now. It's tooth number 15. As you can see, the root canal is actually pretty decent. Look, all the 3 canals are reaching to almost the end here, the end here, the end here. Very nice root canal, very nicely done. I also don't see any voids. Everything is in a good shape. This case, I really am not adding any value. What values am I adding to this one? Let's take a look. The biggest problem in this case, wait for it, it's not just how good it filled or not. The bigger problem is how persistent the infection has been. Look at this periapical infection here. You see, this line, all the line, along the line, all of it is very well corticated. You can see that this has been for so long. This infection has been persistent for years. It's gonna be much more difficult to fix. Again, I'm not adding any value. The root canal looks decent. Again, what are you adding when you are doing a retreatment? Remember the case that I started my presentation with? The one with a lot of pus coming out? This is the case I chose to retreat. This is the case I presented in the first of the video. You can see why I decided that this is an easy win for me and for the patient. Look at this. This is the root canal, the white thing inside the tooth here. It's very short. I can fix that. There are problems. Look at here. It's not reaching. This is the end of the tooth, the root. This is the other end of the root. This is tooth number 14. Most likely, it has 4 canals. So usually, it have another teeny canal that always causes headache as dentists. It's called B2. This is the case I fixed. Here is how it looks after we retreated. The patient now is happy for at least 1 year. These are the 2 factors when I'm doing a retreatment for a previously done root canal. Number 2, the restorability of the tooth. Can I fix it? Does it have enough structure to build something on? The most important factor, the third factor here is what the patient wants. You give the patient the options. You tell them, this tooth has this and that problems. You want to fix it? It's going to be compromised restorably. You can't put a crown on this one, or the crown is not going to live long. I can't give guarantee on or this one. The patient can choose. Do they want just to fix whatever they can right now? They are conservative. That's actually good. I love that. I like agreeing with that. That's no problem. Some patients like to just get the most predictable outcome. Take it out. Let's do an implant. Success rate is more than 92% over 5-10 years based on many researches. That's fine too. These are my choices. Can you please let me know if you have any additions in this video? Thank you.